All right, Tracy, you can go ahead and get started.
Thank you. I am Tracy Bath. I'm a health educator at Columbia Boone County Public Health and Human Services. I am also a former childcare teacher, so just wanted you to know that. First, we wanted to thank everybody who is on for attending this. We know this has been a very difficult 2 years for all of you. You work in a unique profession that has children who are under 5 and not able to be vaccinated, and some children not able to wear a mask. So that makes our guidance somewhat, more complex for you. And then between changing guidance and staffing shortages and just exhaustion from both you and the parents, this is just, we wanted to acknowledge that this has been very hard. And we are here today to talk to you about guidance and also about just COVID and kids. And also, we have someone that's going to speak, and I'll get to introductions in a moment, about other things we can offer you from our public health office that it's not COVID. So anyway, first, I wanted to do a couple housekeeping announcements. Everyone is muted. We do have the ability to unmute people if needed, but for right now, we just wanted to, wait, I hear you fine. Oh, okay. But please feel free to put questions in the chat, and we have staff who are looking at those questions. And we can also get to them at the end of the segments as well. We'll have 3 segments. So the other thing I wanted to say is that the slides that we're using can be sent out, or will be sent out to all of you, just so you know, so you're not feverishly writing or whatever, we'll send them out. We do ask that if any of you are on here that would like the clock hours, to please put your full name. I know I see names on your boxes, but it may not be you that's using the Zoom account. So your full name and your email address, so that we are able to send you a Google form with a couple of questions so that you can get your clock hours for attending. So those are the housekeeping announcements. And now I want to introduce who will be speaking with you today. So first, we're going to have Dr. Ashley Millam, and she's our medical director. She will be, again, talking about children and COVID, just a kind of a primer of what's been going on. And then after that, Suzanne Radcliffe, who leads our school guide, all of COVID-19 guidance, but particularly school guidance for this group. And she will be talking about our isolation and quarantine guidance. And then finally, we have Taylor Noth, who is one of our public health nurses, and she will be speaking about the childcare consulting program that we have. And then finally, we have Michelle Scheichels, who is the health promotion supervisor. She supervises the health educators like myself. We're very, very lucky to have her. And so Michelle, and then also Sarah Vivaro is another health educator. They will be looking at the chat and answering questions and just making sure people have their questions answered. And finally, Trina T. Cutter is our nursing supervisor, and she is also on here to answer any questions as well as they come up. So I think what I'm going to do, okay, I saw Dr. Millam on, and now I do not.
Actually, we're going to switch it up just a little bit, and we're going to have Suzanne go first.
Perfect. Okay, that's great. I can do it. I can switch around. So Suzanne is one of our health educators, as I stated before, and I will let her start to share the screen for her slides. So thank you.
Thank you, Tracy. And it's so nice to put some names. I saw a few faces there, people I've spoken with on the phone before with some of you. But yeah, we'll go ahead here. And Michelle, I'll probably have you go through the first, there you go, few slides. There, oh, one more. There we go. Okay. So I'm going to be discussing a lot of the updated quarantine and isolation protocol that the CDC has put out, recommended quarantine and isolation. A lot of this information has been sent out to daycare providers back in January. So some of it may be repetitive, but nonetheless, I thought it would be helpful to just kind of walk through when someone's talking through it. I'm going to just go through a few definitions just to kind of clear some understanding about what terms mean. After we talk about quarantine and isolation, I'm going to share with you a document that you may find helpful to give to families of children at your centers to help explain the protocol. And then some additional CDC recommended COVID mitigation measures in addition to quarantine and isolation that you can put in place at your daycare or childcare facilities to help reduce COVID transmission. Next slide. Thank you. So first off, defining isolation and quarantine. Sometimes people intermix these two terms, and they are different. Isolation is for individuals who test positive for COVID. So whether or not they have symptoms, they are to isolate or stay home away from other individuals so that they're not spreading the virus. Quarantine is for individuals who have had close contact to someone who has tested positive for COVID. And it keeps them separated from others during the time period where they're waiting to see if they become sick with COVID-19. And the definition of a close contact. So if you've spoken with me on the phone, you may recall that I've asked, well, was the person within 6 feet for X amount of time? We have a certain distance and time frame in which someone is considered a close contact. That is being within 6 feet of a COVID positive individual for a cumulative of 15 minutes or longer over a 24-hour period. So that can be 15 minutes at once. It can be 5 minutes at the craft table, 5 minutes at recess, 5 minutes somewhere else within the 6 feet. So it can also be just added up cumulatively over the 24 hours. Next slide. So now we're going to discuss what to do when an individual tests positive. So when someone does test positive for COVID-19, regardless of whether or not they're vaccinated, they need to isolate. And the ability to correctly and consistently wear a mask is also going to kind of have an impact on someone's isolation period. It's going to mean they either isolate for 5 days or 10 days. And that is because mask wearing is part of the CDC's recommended guidance of isolation and quarantine. There's a time period at which you need to be able to wear a mask. So the first step that you would likely take if you have a child at your facility who is COVID positive or a staff member is determine if that individual can consistently and correctly wear a mask. So if so, they will be isolating at home for 5 days. They should not come into work or childcare for those 5 days. The remaining 5 days, they do have to mask, and I will get into the details of that. But what may be more applicable in a childcare setting is a lot of the children are probably going to be under the age of 5. They're probably going to be in the age range where it may be difficult for them to wear a mask. If they're under 2, they should not be wearing a mask anyway. So the isolation protocol there is that they would need to isolate for 10 days since they cannot complete the other recommendation of mask wearing for the additional 5 days of isolation. Next slide. Okay, so calculating the recommended isolation period. We go by symptom onset date of the individual who's COVID positive. So if they have symptoms, we consider that day 0 of the individual's isolation period. If they do not have symptoms, then we go by the date that they took the test that gave them the positive result. Day 1 of their isolation is the following day. Like I said previously, if the individual can consistently and correctly wear a mask the entire time they're around others, they can end their home isolation after 5 days, as long as they are fever-free for 24 hours without fever-reducing medication. If they had symptoms, their symptoms need to have been improving by the end of those 5 days, or if they didn't have any symptoms at all, they can leave after the end of those full 5 days. So from days 6 through 10, then going forward, again, if they can wear a mask, they can return to the childcare setting or to their work, as long as they're wearing the mask anytime they're around others, even if their symptoms have ended. If they continue to have a fever after day 5, if they wake up on day 6 and they still have a fever, they need to stay in isolation until they meet that criteria, fever-free of 24 hours and symptom improvement, until they meet that criteria to come back to childcare or their work. Still masked. Next slide. Okay, so just some more examples about calculating isolation. I get quite a few questions about this, and it's just kind of an easy template to use when thinking about how to figure out the days. So if the individual is positive and they're able to wear a mask, they're going to be doing a 5-day isolation period, 5 days at home. So for example, Joe is a fully vaccinated 5-year-old. Let's say that he is able to consistently, correctly wear a mask. Maybe you've seen him wear a mask at daycare in the past. You know that he's good at wearing a mask. Some children this age can. So we're going to say that he can wear the mask. So he's going to do a 5-day isolation. So if he tested positive on February 3rd, but he had symptoms starting on February 2nd, his isolation timeline would look like the following here. February 2nd would be day 0 for him, since that's the day he experienced symptoms. February 3rd is day 1. Day 5 for him is February 7th. So he is still home that day. That is his 5th day of isolation. As long as he is fever-free for 24 hours without medication, and his symptoms have improved, he can return to childcare on day 6, which is February 8th, as long as he wears a mask anytime he is around others through February 12th, which would be day 10. If the person who is COVID positive is unable to wear a mask, they're going to be doing a 10-day isolation. So for example, we'll say Jill, she is an unvaccinated 18-month-old. She's unable to mask. She tested positive for COVID on February 1st. She did not have symptoms. Her isolation would look like this following here. Day 0 would be February 1st, since that's the day that she tested positive. So the second is day 1. Her 10 days is through February 11th. So she stays home through February 11th. And as long as she has not developed symptoms, she can return to childcare on the 12th, which is day 11. So that was a long step 1. I realized all of that was under step 1. It shouldn't take that long when you're actually going through the process. So step 2 is to now immediately notify all close contacts within the childcare facility. And again, you're going to be using the close contact definition to determine this. Do not reveal the name of the person who tested positive. And I should say that you will not be notified by the health department if someone at your facility tests positive. That should be done by the individual. They should be letting you know that they tested positive. Let's see. So in determining close contacts, again, you're going to be considering people who were within 6 feet of the COVID positive individual for a cumulative of 15 minutes or more over the 24-hour period. Now, this is beginning 2 days prior to the COVID positive individual's symptom onset date, or if they didn't have symptoms, 2 days prior to them testing positive. So you're going to need to ask them this information. When did you test? Did you have symptoms before that? Because that's going to help you figure out the 2 days prior and who the individuals are within those 2 days who would meet the close contact definition. I included here even all the way through their isolation period, because if you have contact with someone past those 2 days into their isolation period, you're still considered a close contact. So some children, maybe like, for example, if they tested positive, we'll say today, Friday, or let's say today's Thursday, for example's sakes. Let's say they still went to school though tomorrow, they would still have close contacts tomorrow because they're still COVID positive. So it's just starting from 2 days prior to their symptom onset or day they took their positive test result through their isolation. An individual is still considered a close contact, even if masks are worn. Masks are still helpful because they reduce the risk of you getting COVID, but in terms of being a close contact, they don't remove you from being a close contact unless you were in a medical setting and you were wearing medical grade PPE. But that's not the case in the childcare setting that we're talking about here. Third is to clean and disinfect your establishment. The CDC has said that in general, cleaning once a day is usually enough to remove virus on surfaces. If someone has been sick or has COVID within the last 24 hours, just continue to clean and disinfect. It's probably something that you're already doing as per normal protocol, but just something to remember to do when someone has been sick with COVID as well. Okay, so now on to when an individual is a close contact. So the recommended quarantine guidance from the CDC is now kind of based upon the close contact's ability to not only consistently and correctly wear a mask, but also depends upon their vaccination status or prior history of having COVID-19 in the past 90 days. So children under the age of 5 who are unvaccinated, which is probably a large percentage of the children attending your facility, and who are close contacts to a positive case, if they can wear a mask consistently and correctly, I'm going to give you the guidelines for them to follow then here. They stay home and away from other people. They quarantine for 5 days. So 0 through 5 days, like we had calculated earlier. Day 0 is considered the day after their last close contact with the person who has COVID-19. They should wear a well-fitting mask around others, even while they're at home. And then days 6 through 10, so the days after they leave their home quarantine. They are also recommended to watch for symptoms, a fever of 100.4 or greater, cough, shortness of breath for 10 days after that close contact. Next slide. So if they develop symptoms while they're in quarantine, they should get tested at that time. Otherwise, the recommendation is to get tested 5 days, at least 5 days after your close contact to the COVID positive individual. But we just want people to know that if they develop symptoms before that 5 days, go ahead and get tested at that time. If they were to test negative, they can leave home after the 5 days, as long as they continue to wear a well-fitting mask anytime they're around others or in public. That's 5 additional days, so 10 days from the point of contact. If they test positive, they should isolate for at least 5 days from the date of their positive test result if they don't have symptoms. If they develop symptoms, you're going to isolate for 5 days from the symptom onset date and follow just the isolation guidance that was presented earlier. Next slide. So if an individual is unable to get a test 5 days after their last close contact, which when there's been some issues with acquiring at-home tests or finding a place to go, they can leave their home after the 5 days if they have been without COVID symptoms the entire time. And again, they need to just wear a well-fitting mask anytime they're around others for the additional 5 days after they leave their home quarantine. It's also recommended that they avoid people who are immunocompromised or at high risk for severe disease from COVID-19. So those in nursing homes and other high-risk settings for 10 days after their exposure to that COVID positive individual. So, and again, with children who are under 2 years old, or anyone who is unable to wear a mask when around others. So if you have a 1-year-old at your facility, a 6-month-old, anyone else who's unable to mask, they're going to need to complete a 10-day quarantine. It's the safest option for them if they have close contact with a COVID positive individual, because they can't mask for those remaining 5 days. So we're kind of jumping back and forth, and I apologize, but this is quarantine guidance again for individuals who have had close contact and they can wear a mask. I'm just kind of explaining now how that is relating to vaccination status. It used to be that if you were fully vaccinated, so you've received your 2 doses, and 2 weeks past that, you wouldn't have to quarantine as long as you didn't have symptoms. That has changed a little bit. Now the CDC uses the phrase, if you're up to date or not up to date on your vaccination status, that's going to kind of determine your quarantine protocol if you're a close contact. So what this screen is showing you, we kind of laid out what up to date and not up to date is. So up to date basically just means that if you're eligible for a booster, that you have received it. So if you're 12 years or older and you are boosted, or if you're 5 to 11 and you've completed your 2 doses, or if you're immunocompromised, you may be needing 3 doses, you would not need to be staying home for the 5 days of quarantine for being a close contact. The guidance is just to wear a well-fitted mask around others for 10 days after that exposure. Again, this would not apply to a child who cannot wear a mask. They would need to be staying home for the full 10 days. So the square below it here is for those who are not up to date on their COVID-19 vaccines. So someone who is 12 or older and they're not boosted, or they're 5 to 11 and they have not completed their 2 doses, maybe they've only received 1. Or if they've received J&J over 2 months ago and they haven't gotten their booster yet, or if they are completely unvaccinated. The quarantine guidance for those individuals is over here, which is staying home for the 5 days, and additional mask wearing for an additional 5 days after that. Another category is for individuals up here who had confirmed COVID-19 within the past 90 days of exposure to another individual. They would not need to stay home in quarantine because they have that prior exposure or prior positive test. Okay, next guy. So this information here, and it may look familiar, this is a flyer that we had sent out to childcare facilities earlier in January. It's just kind of a quick reference guide if you have a parent who does have a child who is either a close contact or who has tested positive and they kind of want to know what to do. And I will send all of this back out again to everyone in case you don't have that email anymore. But it's just kind of a step-by-step of what's the protocol if my child tests positive? We address the fact that if they're under 2 and can't wear a mask, these are the steps you need to take. And another question that comes up frequently is household members, and having that continuous exposure to someone with COVID-19 and how that affects quarantine dates. So I just have an example over here to the side. We're just going to go through when children, especially young children, are living with for example, a COVID positive parent or sibling. We all know it can be difficult sometimes to isolate away from them. If they're real young, I mean, what are you going to do? You have to still take care of them. So for this reason, it's possible that the child's quarantine period would not even begin until after their last contact with the COVID positive parent. We'll just go with parent on the positive parent's last day of isolation. So if this sounds like it might be a long time, it kind of is. The child would potentially be home if they were living with the COVID positive parent during the parent's isolation period, in addition to their quarantine period, which would begin after that. So potentially something like 15 days. So for an example, an unvaccinated child has continuous close contact with their COVID positive parent through day 5, the parent's last day of their isolation period. We'll assume that the parent doesn't have a fever, doesn't have symptoms, and can leave after day 5. That day 5, is considered day 0 of the child's quarantine period. Day 1 of their quarantine would be the next day. Okay. So onto some just additional prevention strategies that you can potentially implement in your facility to help reduce COVID transmission. And these are all CDC recommended strategies. They have a lot of good ideas. Okay. So the first one is to promote COVID vaccination among your staff and families. We know that while COVID vaccines for children under 5, they're not here yet, but they are forthcoming. Until then, the best way that we can protect these children is to have individuals get vaccinated who are able to. We have a lot of resources on our website. If you're wanting to encourage your staff and employees who work with you to get vaccinated, FAQs to help answer questions about the vaccine that may be helpful. Even resources if you're wanting to provide information, if you get questions from family members or families of children who attend your facility about, I don't know, should I get my child vaccinated? We've got lots of resources and questions that might come up that you can provide answers to that would help you address any concerns they might have. Consistent and correct mask use. Wearing a mask is one of the best tools we have to help reduce COVID transmission. It's especially important for mask wearing to happen even around people who cannot wear masks or who are not vaccine eligible, especially when you're indoors a lot in places like schools and childcare facilities, to wear masks if children are able to, even when distancing is difficult to be maintained in those areas. So the CDC does recommend that people wear masks, everyone 2 years and older, regardless of their vaccination status. Outdoors in general, they say that masks don't need to be worn. However, in areas of high COVID transmission, or if you're just in a crowded setting outdoors, it may be something, if you're older than 2, that you choose to still, excuse me, you choose to still help people wear masks, especially on the playground. I think it's kind of tricky for children to stay away from each other, constantly running and interacting. Maybe there's some, I don't know, tumbling and stuff happening. So if they are older than 2 and able to wear a mask, it may be something that you still encourage them to do when they're outside. Next slide. So physical distancing and cohorting are a couple of measures that can help reduce COVID transmission. We realize that these are two that may be difficult for a lot of childcare facilities to implement just because of the spacing that's kind of required to make them happen. But nonetheless, if you can do them, something that will definitely help. If you can't, that's why it's important to keep doing things like masking and improving ventilation and making sure hand washing and proper respiratory etiquette are in place to help reduce transmission risk as well. But cohorting is something that can help reduce spread if someone is positive with COVID. And that is keeping people together in the same small groups throughout an entire day, just to limit the number of people who come into contact with one another. So below I've got listed there some ideas on how you can do that. We've had a few people ask about nap time. That's a great question. Separating nap time mats or cribs, if you can do that, space them apart is helpful. Placing them head to toe kind of increases that distance for distance between respiratory droplets maybe being exchanged in the air there. Ideally be placed 6 feet apart, but we know that's not always possible. Masks should not be worn when the children are sleeping, even by children who are within the 5-day period after returning from quarantine or isolation. So they should be spaced 6 feet apart if they can, if they're going to be coming back and not having a mask on. Providing guides on the ground, such as, wall or floor tape marking 6 feet if they're standing in line to wash their hands or to get a drink. Sometimes that can be helpful to keep them distanced apart. And staggering use of communal spaces, if you are able to cohort, just making sure you don't have groups using the space at the same time. Next slide. So improving ventilation can also go a long way, and just removing a lot of particles in the air. I didn't realize this time of year it's going to be difficult to open windows and doors, but if you can for a few minutes, that's going to be something that can help. Using child-safe fans. If you have ceiling fans, maybe turning those on for a bit during the day, just to kind of move some of that air around. Making changes to your HVAC systems if you're able to. I realize that's a costly alternative, but if you're able to do that or increase the filtration in your system, that would be helpful. And then finally, hand washing and respiratory etiquette. I feel like all daycares are pretty well versed in doing hand washing training and things like that, but keep it up. Provide hand sanitizer if you need to have those in certain spots. Make sure that kids are monitored if they're using that. Setting up hand washing stations, possibly at the entrances of at the entrance of facilities. Making sure that staff are washing their hands after holding or feeding young children or after diapering, things like that. Okay. So a few resources here. The first one is just the general COVID-19 guidance for early care and education childcare programs. And again, I will send all these out in an email so you have these links. The second one is the health department's webpage about COVID vaccine information. And at the bottom of the page is where we have a lot of FAQs that you may find helpful if you receive questions from people about the COVID vaccine. The last one is a link to Missouri's Department of Elementary and Secondary Education, their Office of Childhood, just the current regulations. I just put it there just so people could reference kind of what the current regulations are. I'm sure many of you are already well versed in them and aware, but just for your reference, they are there. Next slide. Okay, so now we're going to test your knowledge a little bit about quarantine and isolation. No pressure. This is just a fun little multiple choice quiz. So if you want, you can put your answers in the chat. 1-year-old Johnny attends your program. His mother, whom he lives with and who cares for him, has tested positive for COVID. How long does Johnny need to quarantine for? Your options are 10 days, 0 days, 7 days, or 5 days. You guys are making me so happy. All right. And yep, the answer is A, 10 days. So I think we have one more question lined up. Okay, so related to this first one. So Johnny's mother is not able to isolate away from him during her isolation period. When will the clock begin for counting Johnny's quarantine days? The day after mom's isolation ends, the day mom tests positive, or the day Johnny gets a COVID test? Yep, it's A. You're all right. So it just makes me feel like maybe you guys kind of got a grasp of the quarantine isolation protocol. As I hope you know, anytime you have questions, please reach out to us at schoolguidance@como.gov. It makes us feel good that you feel like you can come to us with your questions. And I know everyone else on the school guidance team is happy to always take your calls and walk you through whatever scenarios you have.
Okay.
Go back to that question, Tracy, did you see that?
I did. Let me
I figured it was
back.
easier to talk about it than to put it in the chat.
Sure. The child's day 0 wouldn't be the day after the parent's day 5. Did you want to take that, Trina?
Well, it doesn't matter. I think that what we're saying here is that their day 0 is their last day of exposure, correct? So the last day of exposure for the child would be the parent's day 5 of isolation, right, Suzanne?
Yeah, and I'm just saying, if the parent was able to isolate away from the child, or let's say they only had exposure to the COVID positive parent on day 3, well, that's fantastic. So yeah, we just go by the day of last exposure. I just used 5.
Well, but the day of last exposure is the child's day 0.
Right.
Correct?
Yes.
Yeah.
Yes.
Mm-hmm. Okay. Well, thank you for helping answer that, both of you. And then I am going to now pivot to Dr. Ashley Millam, and she is going to talk about COVID-19 and children. And I think we'll put her slides up. Michelle's doing that. Perfect.
Hi, I'm Ashley Millam. I'm a family physician and the medical director at Columbia Boone County Public Health and Human Services. And so I think that probably, I suspect you all kind of hear this information too from parents that understandably feel frustrated by the challenge of isolation and quarantine, how that can impact their day-to-day life. And so there are some key pieces of misinformation that make it really challenging for parents to understand the importance of these public health measures and recommendations. And so I think I wanted to make sure that we're able to empower you all with the information that we have. And so, and even in my clinic, I hear this particular piece of misinformation a lot, that kids just don't get sick from COVID-19, and that's just not true. I wish it's true, but it's just not. And so we definitely see the majority of kids fully recover from COVID-19 as an adult. Fortunately, a lot of people do okay in the long run. but that's not universal, even among healthy kids. And so I think it's important for us to be able to empower our childcare leaders, you all, and then also empower parents to just really know the reality that unfortunately we do see even healthy kids, but kids in the hospitals, even locally, even on ventilators. Unfortunately, we even have seen kids die from COVID-19 infection specifically. Unfortunately, these numbers have increased significantly in terms of hospitalization of kids who are getting hospitalized because of COVID-19 infection. And then the other kind of piece of this is that even for some kids who are not seriously or severely ill to where they require hospitalization during their acute infection, some of them do develop long COVID, meaning that they have symptoms, sometimes things like feeling very tired or feeling short of breath whenever they exert themselves. That can often last for months. And so these are unfortunate things, but they are the reality. And so it's important that we empower our community with this information. And then kind of just in a pictorial forms that you all are able to really see the increase in hospitalizations. The next slide here shows this is the national numbers. And so you can see that over the course of the last year, there's certainly been some waves, but we are just seeing a dramatic increase in hospitalization. So this is across the country. And then in the next slide, you can see specifically to Missouri. Unfortunately, we're in the orange zone there. So we're seeing this exact same trend in the state as we are nationally. And then on the next slide, we can see specifically locally here at our children's hospital, the significant increase. So we're talking specifically kids who are hospitalized because of their COVID-19 infection. They're seeing 1 or 2 a few months ago per day. Then towards late December, it was more like 2 or 3. Again, children, people under the age of 18, specifically hospitalized because of COVID-19 infection. And then this was from Dr. Christelle Ilbudo, the infectious disease specialist at the Children's Hospital here locally. This was from her information last week. And so she was seeing even 5 to 10 per day that's the middle part of January. Also, unfortunately, seeing an increase in ICU admissions for pediatric patients as well. And then there's other viruses going around. And so it really is insult to injury whenever we've got kiddos who have RSV plus COVID-19. And then the next slide, it kind of just has a different format. So whenever I looked at the exact census on Sunday, we had 4 young children in the ICU due to their COVID-19 infection. And to be clear, ICU means that these children are critically ill from their infection. So most patients in the hospital do not require this level of care. And then on Tuesday, there were still 2 kiddos in the ICU, specifically in our hospital, still requiring that very intense level of care. And then 11 other children in the hospital due to their COVID-19 infection. And so, you know, I wish that it wasn't a serious concern in kids, but it really is. And so that is why, as inconvenient as it is for parents and our young families in our community, it is just imperative that we try to encourage folks to follow the recommendations, because it really does save lives being able to follow the public health measures.
Okay, thank you so much, Dr. Millam. And again, people can put questions in the chat. Our next presenter and final presenter is Taylor Noth, and she again is a public health nurse, and will talk about the childcare consultation program. Again, something that we can offer you that is not necessarily COVID related.
Hello, everybody. My name is Taylor. I'm the childcare health consultant here at the Columbia Boone County Health Department. And I'm just going to talk a little bit about what we can provide to you as childcare providers. Next slide. Okay, so we can do meetings. We can do face-to-face, like if you want to meet in a park or something, or we can do virtual meetings. The most common is usually a phone call. So usually what we talk about is something pertaining to your specific facility. It can be either a health or safety goal, such as biting or like nutrition. And then we also do disease consults. So say you have a kiddo who has RSV. So you might want to learn a little bit more information of what that is. You might also want to know some things like when this child can return back to care, if you need to do any extra disinfectant or infection control things, kind of in normal times, like if this kid would need to wear a mask or anything like that. Just a little bit more information so that you can properly care for all of the kids at your program. And I can also provide like handouts that also goes over what we discuss in these meetings, just so you don't have to stress out. It'll all be on paper. And I can also provide handouts for parents as well, if they had any additional questions or if they've had any pushback or anything about some of the information that we discussed. Next slide. So another cool service that we can do is we provide classes. So usually these classes are, we email them out whenever we provide these, and then you can also view them through the Missouri workshop calendar. So you're able just to see whenever we have these offerings. So the trainings for providers, you receive clock hours for attending those. So just like with today, whenever you have your email address in there, I'll get in touch with you so that we can get you some clock hours for attending this Zoom. Just a couple classes in the past that we've done. There's like oral health stress management, sensory integration, just a cool variety of topics that you can learn a little bit more to be more well-versed with your kids. And then another cool service that we provide is we do on-site classes with the kids. So we would go physically to your facility and do a 30-minute class with the kids. In the past, we've done a class like hand washing, which I know everybody is great at in doing, but it's kind of a cool thing where we can put a treatment on kids' hands, and then we light it up with a black light, and then they're able to see on their hands kind of all the spots light up, and then we're able to do different songs and teach duration and how to clean under your nails and all that good stuff. And then the kids are able to see like how you really can reduce germs from hand washing, and just a lot of cool different classes that we have the ability to teach for your kiddos. And again, just make sure that your name is in the chat so we can get clock hours for you. Next slide, please. And then this is my contact information. If you wanted to shoot me an email, phone call, that's great. If you also just wanted to contact the health department, you can always get routed to me. Just say you're a daycare provider wanting to talk to a nurse about anything, and that'll get routed to me as well. COVID has been different. We've not been up to full steam yet, but we're looking to kind of vamp up and do some more classes, do things like CPR classes, and just be here as a resource. But we are definitely here to provide as many services as we can, and we're here if you'd like to reach out to us.
Thank you, Taylor. So are there any other questions? I see something, day after mom's isolation ends. Did that get answered, Jessica? I see that in the chat, but I wanted to make sure that we have everything answered before we adjourn the training.
Tracy, I think that was an answer to the
Perfect. Okay, perfect. Thank you. Okay, so if there are no other questions, we really do appreciate everyone's time, for everyone being here, and really, trying to unravel some of all of this complex guidance. And again, we are all happy to be there for you. We know this has been such a difficult time. We have received your questions and your calls, and we will continue to do so through the school guidance email. And we thank you, so much for giving those to us and caring about your kiddos and your families and wanting to have the right information. So we really do appreciate everything that you're doing out there, because we know it can be very difficult. So if no one has anything else, we can end this meeting, and we really appreciate this training. We really appreciate everyone's participation.